An estimated 65% of new COVID cases are now linked to the newest subvariant, BA.5. Health officials say it's more transmissible and better at evading immunity. ABC's Morgan Norwood has more.
With COVID-19 resurging across the U.S., health officials now sounding the alarm about the BA.5 variant, warning it could be the most transmissible yet.
As the virus changes, as it mutates, little changes occur to parts of the virus, one in particular called the spike protein. That allows the virus to get around the protective factors, those antibodies that the vaccines and previous infection have given us.
Right now, BA.5 is the more dominant variant in the U.S. Newly updated federal data shows that it makes up an estimated 65% of the more than 100,000 estimated new cases per day. Since most home tests go unreported, experts warn that number could actually be 7 times higher, according to one estimate. Still, there's an estimated 5,200 admissions of COVID-19 positive patients each day, the highest number since February. Meanwhile, the push to get more Americans vaccinated is leveling off. 78.6% of the total population has received at least one dose, and 67% of the total population are fully vaccinated. And experts say to ward off this variant, vaccinations are critical.
My recommendation is that each person should remain fully vaccinated, up to date in terms of who they are, what vaccine they received, their age group, and their risk factors, and that will vary.
As BA.5 continues to spread, Moderna is gearing up for its variant-specific booster, saying its vaccine candidate produced almost 6 times the number of neutralizing antibodies against BA.4 and BA.5 subvariants, 1 month after injection. But that new shot won't likely be available until October or November at the earliest.
There is some urgency to figure out the composition of the vaccine for the fall. We don't want to be in a situation where we have a rise in cases ahead of vaccination and we're trying to play catch up.
Morgan Norwood, ABC News, Los Angeles.
Locally, COVID cases are trending back up. Today, the Virginia Health Department reported almost 3,300 new cases. That's about the 7-day average, which is that's above, that is, the 7-day average, which is 2,900 and steadily rising. Hospitalizations are also rising. Right now, 672 people statewide are getting treatment for COVID in the hospital.